Senator, how would you like to take these bills? 312 first?
Sure.
Sure.
I've got a stack, so I'm just 312. That'd be great. Yeah. Okay. Assistance here as well. This is on Senate Bill 312. Thank you, Madam Chairman and members. Provisions in current law encourage Louisiana communities to fluoridate have been met with minimal success, and that's really what we're going to try to do today is offer up this bill, which would amend current law to require all Louisiana water systems with 5,000 or more service connections to fluoridate to optimal levels. Those systems not currently at optimal levels would not have to comply until, and that's really the key here, until the state has identified and made available funds for the initial expense. So that's something that was very carefully thought through and making sure that we're not imposing a mandate in that regard. But we would stipulate that these local governments would have to submit a cost estimate to the Department of Health and Hospitals. This would at least get Louisiana on the road to providing a substantial health benefit to its citizens and ultimately realizing substantial savings in health care costs. Fluoridation is safe, effective, and economical in preventing tooth decay, and yet today, about 67% of the citizens of Louisiana do not have ready access to optimally fluorinated water. Fluoridation is the community public health measure that obviously saves money. For communities, for every dollar invested in water fluoridation saves $38 in dental treatment cost. The study conducted in Louisiana has shown that children who live in communities without fluoridation are 3 times more likely to end up in the hospital to undergo dental surgery. So that alone in itself will give you some pause to think about why we need to do this. Leading public health groups such as the Center for Disease Control and Prevention, the American Medical Association, the American Dental Association, the American Academy of Pediatric Dentistry, as well as the Louisiana Department of Health and Hospitals and others recommend fluoridation of our public water. I see there is a set of amendments. These are technical amendments. I'd like to
Michelle will bring those for you, Senator.
Members, you've just been passed out a set of amendments to Senate Bill 312. The majority of these amendments are purely technical in nature, but amendments 3, 5, 9, 10, and 13 are changing some language in the bill. We're changing reference from minimum levels of fluoride to levels of fluoride that are within the optimal range. I believe that according to the Office of Public Health at DHH, this was a more precise way of referring to and measuring fluorides and measuring fluoride levels in the public water system.
For the record, Madam Chairwoman, members of the committee, Kevin Hayes on behalf of Louisiana Dental Association. That is correct. There was a Bureau amendment put on which kind of brought this to our attention, and so we worked with Michelle to kind of correct that language.
I'll offer those amendments up. Do I hear any objection? Hearing none, those amendments are part of the body.
Okay, so
you've already spoke. Ward, would you like to speak?
Just to add a couple points. Specifically,
say your name. I'm sorry.
I'm Ward Blackwell, Executive Director of the Louisiana Dental Association. One of the things that Senator Mount referenced was the savings in healthcare costs for water fluoridation. In fact, there was a study done specifically looking at Medicaid costs in Louisiana. The Department of Health and Hospitals analyzed Medicaid dental reimbursement data. And it clearly showed that, in fact, in parishes in Louisiana that had fluoridation versus non-fluoridated parishes, there were substantially lower costs for treatment for dental caries in those parishes. The savings ranged from $14.68 for 1-year-olds to $58.91 for 3-year-olds, with a mean difference in treatment cost per Medicaid eligible preschooler of $36.28 a year during the course of the study. According to that particular study, there's an estimate of the 39,000 Medicaid-eligible preschoolers in Louisiana. The annual reduction in dental treatment costs could be $1.4 million if they were all able to access fluoride in the water. It clearly is a cost-effective public health measure. There's more than 60 years worth of research that's been done to ensure that in fact, it is safe. And specifically addressing some of your concerns, Representative Katz, we looked at the issues as far as osteoporosis in older women being a problem. There are absolutely conclusive studies that have looked at that particular issue, looking at an individual, non-ecological basis, and in fact, one of those studies was done by a group that originally thought there might be an issue. They came back and did a different version of the study. There is no correlation between exposure to fluoride and increased risk for fractures in older women.
And Ward hit it, Chairman Katz. I had the studies that I was going to, because we had been talking about this for several months, that I'd done some research, and clearly the studies show there's no correlation.
Thank you. In support, but not to speak, David Tatman, the Louisiana Society of Oral Surgeons. Provide information, Sean Nolan from DHH OPH, Glenn Chambray from DHH, Jane Bergen, Louisiana Dental Hygienist Association. In support, not to speak, Dr. Dion Richardson, Department of Health and Hospitals, Oral Health, and Roger Barsley, LDA. I have an amendment that I'd like to introduce to the bill. Michelle, you have that for me, don't you?
Yes, ma'am. Members, this is not a typewritten or a typed amendment. I'm going to read it to you. It's on page 2 at the end of line 22. At the end of the line, we're going to change 30 to 15. Again, that's on page 2. At the end of line 22, change 30 to 15. So that sentence will read, a petition requesting the exemption has been signed by at least 15% of the registered voters, etc.
Senator, in the amendment, I was afraid that if someone did want to do a referendum, that 30% might be very difficult on a petition to get. So I'm offering up that we change that to 15%.
And Madam Chairwoman, we talked about this, and we understand your concern. Mr. Blackwell and I were discussing outside. We actually copied this language out of current law and another statute that allowed an opt-out, so it wasn't a 30% that we made up. It's in current law.
Well, my 15% is one I made up.
I understand. Yes, ma'am. But I just wanted to let you know that's where the number came from, and we weren't trying to do anything to raise the bar. It's a provision in current law that we
no
kind of
problem
borrowed.
in that, and I hope everyone understands what I'm doing. If citizens want to do a referendum to opt out, then I've lowered the bar with this amendment if it's agreed to by this committee. But anyway, I'm offering up this amendment. Do I hear any objections? Question. Excuse me. No. Yeah.
I was under the impression that we weren't going to have amendments on bills today under the 24-hour rule. Is that?
No. Lengthy amendments. Lengthy amendment changes, sir.
Okay. Thank you.
That was a question. Is there any objection to this amendment? Hearing none, that amendment is passed. Representative Labruzzo.
Thank you, Madam Chairwoman. I know there's Mr. Labat is on the Appropriations Committee with me dealing with health matters, and we had a packet given to us. I wish it would have been given out today again, dealing with children and dental problems, and the pictures alone would illustrate to you the need for fluoride in the public drinking water. It provides people throughout the financial spectrum, each and every one, an opportunity to take advantage of fluoridation in the water and potentially save uncountless dollars in pain and aggravation. And I couldn't imagine the embarrassment that these children had to go through as well, with their whole mouth just totally decayed. It was these horrible pictures, and I think this is definitely a step in the right direction in trying to protect, and particularly our young children, with dental disease. So I would like to move favorable at this time.
I guess at the appropriate moment, sir, I have a light up. Representative Williams?
Thank you, Madam Chair. Actually, that's what I was going to do as well, because there's too many times that we take, I guess, the dental profession a little bit lightly, and so I think this is an area that we definitely need to go, and I applaud this this bill. Thank you very much for that.
Thank you. Representative Abramson?
Thank you, Madam Chairman. I support the bill too, but I have some questions. The amendment changed the parameters from less than minimum to outside the optimum range. What does that do?
You mean the original amendment?
The amendment
Or Mrs. Katz's amendment?
No, the amendment on the optimal range, the two-page.
That was a recommendation by the Office of Public Health within DHH, and I believe...
I'm sorry, I just need to get the question.
Yeah, and I'll give you my mindset of where I'm going. I know there are some systems, water systems, including Orleans Parish, I understand, that already has fluoride. We're already doing this in New Orleans. Right. I guess my concern or my question is, those who are already doing it, is this change from a less than a minimum to an optimum range somehow take them outside of the parameters of what they're required to do now, and now they've got to do something different? Because there's a difference between a minimum and an optimum range. I guess you could technically be above it or below it. I mean, optimum range and minimum is different, and if you could help me understand that, and also give me some comfort level, at least those that are already doing it aren't going to have to do something different, which is going to incur time and expense.
I'm Dr. Deanne Richardson, the Oral Health Program Director with DHH. And to answer your question, Representative Abramson, optimum range is basically the standard for the nation. And it just means because water systems are in environments with temperature gradients warm like ours, and in northern parts of the country very cold, that range is developed or decided upon based upon the temperature gradient more or less in the areas that the water fluoridation will occur. So to answer your question, it will not cause anything different to happen for systems that are already optimally fluoridating. And let me explain exactly what optimum range is. That means 0.7 parts per million up to 1.2.
Okay.
New Orleans right now is about 0.8, if I'm correct.
And what's the minimum level?
The minimum would be 0.7.
So the optimum range, the lowest part of the optimum range is the minimum?
Yes, exactly.
Okay. And New Orleans is in the...
New Orleans is good to
You're
go.
safe. You're there.
Thank you. Representative Hill?
Yes, I think I probably missed it, but who pays for this service?
Well, currently there have been two systems that have come on board recently, Crowley and Walker. What we're trying to do is get an idea of what the cost is for the system. Obviously, there's going to be a Medicaid savings that we talked about. We're looking for all types of funding mechanisms. There are federal grants that provide this type of funding. There's appropriations. There's capital outlay. It's a one-time capital outlay, so if there's ever any significant one-time state dollars that could be used to save this dollar in Medicaid, that could be used for it. So we're still trying to develop the funding mechanism. This bill does not require them to do it until funds become available. So that's what we're working on. There was some language that was put originally in HB1 that was taken out that we'd hoped could get back in, that could give the office at the department a little more money to get started on this.
Okay, I agree with this, but we have wells out in our area, so I guess we'll have to go down in our wells. And we're working on a water system, and we have been for a number of years.
And it all depends on the 5,000 service connections, so I don't know how large of service that is with the well in your area, but we didn't want to make everybody do it because obviously in some of the small rural areas it would be difficult to have the injection sites in that.
I think it'd be very good. We would need it for the
Thank you,
children.
Representative.
Yes, ma'am. Thank you.
Representative Nowlin?
Thank you. Thank you, Madam Chairman. Just a couple of questions. I also appreciate the value of fluoridation in the water. When talking about the cost, you said when funds are made available, will these funds, however they're made available, be grants to the local water systems, or are you envisioning some sort of a loan program?
Representative Nowlin, right in the legislation now, it does stipulate though they're not required to participate right away till we find the funds, meaning within our state system or grant system, but it does require the local municipality to provide us with a cost estimate. Therefore, we can strategically plan forward based on the commitment of those individual communities as to how and when we can do the fluoridation. It's quite obvious to you and everybody in the committee how important this particular bill is, and the ultimate health of our young people who are going to grow up to be the leaders of the state is that we provide them the very best source of water that we can so that they remain healthy.
Okay. So, am I correct in assuming that nobody will be required to install or maintain and operate this equipment unless it's paid for by some state program?
Yeah, we weren't looking to mandate local government to do this, and we worked with the LMA to make sure that they were comfortable with the language that's in the current bill.
But I see a limitation of 6 months on the actual chemicals for the chemical feed pumps, that sort of thing.
Right. Then by that point it would be operating. It's very, very, very inexpensive, and the pass-through would be pennies per year.
Pennies per year?
Per year, per person.
It's just that
Per
initial
person.
cost that is, once we pass the initial cost of the infrastructure, if you will, then it's a...
That's the expense, the capital outlay.
What are you going to do if a town on its own has gone out and installed this equipment and paid for it locally? How are you going to handle that situation? Are you going to avoid it or what?
Well, I mean, I don't know how the state would reimburse a town for, or the grant program would. Department of Health and Hospitals ultimately will develop the rules regarding this, and the bill provides that. So,
if a local community wants to opt out, how realistic do you think it is that they would actually have a local referendum on this? I see that the referendum would have to be called by the local governing authority.
after they receive a petition, the language that provision is, if any of y'all have previously been served on House Municipal Affairs Committee, there used to be these elected versus appointed chiefs of police bills, and what the LMA and the Chiefs Association crafted was an opt-out so that 30% of the voters could put it on the ballot. It actually happened in New Iberia, and they actually had 2 referendums regarding an elected or appointed police chief. So I know that it can happen, and I think Representative Katz's amendment does lower the bar on the necessary numbers to get it on the ballot.
Would this prevent a community from having a referendum without a petition? If the governing authority simply said, we want to put this on the ballot, couldn't the community do that?
Yeah.
I think this simply says that if you get a petition with 15%, they must
They
call
have to do it, right.
Right, but they could call a referendum without the petition.
Right. This focuses just on the opt-out issue, but you're right. I mean, local autonomy is at the heart of
Anytime.
the beat of my heart, for sure. We want to protect local government and their
I know.
abilities to make those decisions.
All right. Thank you, Madam Chair.
Thank you. Representative Burford.
Thank you, Madam Chairman. We have several water districts in my area, and some serve municipal as well as the rural. Now, who would be the governing authority, or would there have to be a cooperative agreement between a municipal being served and also the rural part of that water district, or is it the water district itself is the governing authority?
I think one of those issues would be the 5,000 or more service connectors. So I think that kind of defines that area. So your suggestion is probably a good one, in that if you had a district, a separate, everybody was working together, but you had 2 different local entities in creating some kind of cooperative endeavor.
Who would be the governing authority?
I would
the
anticipate
police
local
jury, or
government.
would it be the town or the city that the water system serves?
As the bill is drafted, it would actually be the municipality.
And they would speak for the rest of the system that was outside the municipality.
If that particular municipality was in providing water to other...
Well, in my case, it's an independent system that supplies water for a municipality and also all of those residents outside the municipality. And I was just wondering whether the police jury would have to call for that election, or whether it would be police jury and the municipality.
Possibly we would want to consider an amendment to meet what you're defining,
Because I believe
which
I
is
have
kind of
a-
an anomaly that there may be more of those than we
I
realize.
think
So-
there are, and I think our system would be interested in this, so
Sure.
I would like to get clarification on that point.
And then I guess between here and the floor, is that okay, Representative?
Yes, ma'am, that would be
And I'm certainly agreeable to that.
Yeah, the bill actually said it's each municipal government in whose jurisdiction the water system
So it would
provides
be
services.
both,
So it,
if that occurred.
Be the police jury in the case of the rural, outside
Right.
the boundaries of the...
but it actually specifies each municipal government that is receiving services from that particular water.
Well, you'd have to have agreement from two entities to
Yes, sir.
accommodate the...
That's how I would read it.
So one couldn't enforce something on the other.
But the number of people who would sign the petition would have to come from the entirety of the district, or would it be municipal service, people being served, or those outside the municipal?
It's based on 15% of the registered voters in all municipalities served by the water system.
All municipalities. Now, the outside municipality is
That's
not
right.
considered a
That's
municipality.
right. That's right. I hear you.
Yeah, I mean, unfortunately, yeah, we're not trying to disenfranchise anybody, but
No, I just don't want to run into a problem once we...
We could change that municipalities maybe to electors or something, language like that, which would cover that would cover everybody, the
Yeah.
voting electorate in that.
I think
We'll work on that
we agree in
between,
philosophy. Yeah, I think we can just work on that between now.
and Representative Burford will work with you that and get that cleared out, and we'll do it there.
That's fine.
All right, my board is clear. Who did the motion? We have a motion, Representative Barrow. We have a do you still need to speak before the motion, madam? All right. Representative Labruzo has offered up a motion to move this favorably as amended. Do I hear any objections? Hearing none, this is moved. Thank you.
Thank you, Madam Chairwoman, members of the committee, for your time.
And now we'll do Senate Bill 540, Senator Mount.